All governments control the efficacy and manufacture of medicines, biologics and medical devices through regulatory agencies such as the FDA in the USA and the EMEA in Europe. They do this by the application of good manufacturing practice, or GMP, sometimes called CGMP, which stands for Current Good Manufacturing Practice. The principle of good documentation is as applicable to laboratories as to production, and this is emphasized in both the US and EU GMP guides. US CGMP requires that personnel should receive training appropriate to the duties assigned to them, a rule that applies not only to manufacturing but equally to laboratories and their documentation. The manufacturer is not allowed subsequently to deviate from this specification without prior approval of the regulatory authorities. Of course, finished product specifications are not the only ones against which laboratory testing is carried out. There are specifications for starting materials, specifications for intermediate. Be sure for each requirement that the specification contains a reference to the local procedure against which testing has to be done. Another point to remember: pharmacopoeial methods are written from a very general standpoint, and no two technicians would necessarily employ exactly the same equipment and techniques if they had only tried to assemble furniture from a flat-pack kit. In this course we are focusing on laboratory documentation, but the same considerations apply to sampling procedures, all of which are the responsibility of and need approval from the head of the quality department. It is essential that such documents have a language so that they are completely understandable, and understandability is not just about language. It can be the choice of words. Keep them as simple as possible. One could write, for example, triturate the compound, or alternatively write, grind the compound into a fine powder. They mean the same thing, but which one will nowadays, with the universal use of word processors, much of the typing of procedures may be done by people who understand the technical content, but may be under severe time constraints, and if it has to be set in a central typing pool, be very careful. Always ensure that the procedure SOPs are checked by someone who really understands the particular procedure. In the second we have the display, and in the third stage we have the record. The analyzer could be anything from a chemical reaction in a beaker, the separation that occurs in any form of chromatography, or the events that take place in or on a nutrient agar plate during incubation. When the analyzer has done whatever it does, its output is presented on a display. Any calculations or mathematical manipulations of the primary data, those calculations should be documented in the records in a way which would allow them to be checked and verified to be correct. When performing any such mathematical manipulations, be careful to remember to present the final result in a usable form, in the same units and number of decimal places as those quoted in the specification.